everyone can hear. So next week, we'll have group planning. Back of the Hill, that group will meet with me from 8 to 9. We'll meet in our room, that I set up in Blackboard Collaborative Ultra at 8 o'clock. We'll begin to work on I call it a framework, a template. Okay. If you send me your survey, right, everyone needs to send me their survey so I can send it to the coordinators. We may have a response by then, and it's okay if we don't, because we certainly can begin this template, this framework that we're going to start. So Miss Holloway, you certainly can join us also with Back of the Hill. Okay. Now, so then Miss Byrne, I know Back of the Hill, before I go on, is Jacqueline, Amanda, Katerina, and Molly are going to join us in the Blackboard Collaborative Ultra group. So Miss Byrne, I know you were going to meet with St. John group.
Yes.
Is Dominique, Genesis, Akriti, and Morgan. And you were thinking of changing the time. Is that right? Were you going to start at 8:30?
Yes. Is that okay with everybody in that group if we started at 8:30 and went 8:30 to 9:30?
So that's Morgan, right? Morgan, Akriti, Genesis, and Dominique. Is that okay? You can respond in the yes box. We'll send an email to them.
Yep, that's fine.
That'd be
I will.
Great. I mean, they are supposed to be in class by 8, so we're giving you a little. I mean, you can meet at 8 o'clock without a doubt, and start talking. But
I'll join you. I'll join at 8:30, folks. So
they've all responded yes in the chat box.
Oh, I'm sorry. I'm writing, so I didn't see that. Thanks, guys. If it's a problem for anybody, just, you can shoot me an email and we can put it back. But
it is class time, though.
It is class time. So they should be available. True. Yeah.
Right.
Thanks.
And then YMCA preschool. I have Omani, Logan, Haley, and Echo. So Miss Byrne, you would like to meet them from 9:30 to 10:30? Is that good?
Yeah, I did. Yes.
Okay.
I wanted to meet 9:30 to 10:30 only because, folks, we're getting dangerously close to the the end of class there if we meet until 10:50, and I don't want you to go over because I know you have another class. Mm-hmm. So the YMCA preschool group, can we meet from 9:30 to 10:30? Is everybody, is that okay with everyone? Okay, good. Echo says okay.
Awesome.
It's our class time, so it should be okay for everyone. But, let me know if not.
Okay, I will post those new times on Blackboard because I have the times that we have on the calendar of instruction. So I will post the new times.
So Dr. Laspina, did you want me to send the groups each the new time, those two groups, my two groups, the revised time as well
Sure. Yep,
in an email? Okay, I will.
Sure. That would be great. The rest of the students, you can meet. It is optional. You can meet in your groups because you need to start working on your project. There's a framework that I call it framework, you can call it template, that I designed. It's something very easy. Okay. You'll only be able to do the top portion. What I mean by that is there's going to be questions there. There's prompts saying you're going to list the group of students who are doing this project, the time of your event, the actual name of the event, of the group that you're going to, like, YMCA International. You would put that on there. You're also going to decide on your clinical attire. On your attire, whether you want it to be scrubs, whether you want it to be street clothes, whether you're going to wear your white coat. Most of this is going to be virtual. So a lot of students from the summer have decided to wear their lab coats because you want to look professional. Remember, this is going to be recorded. All right, some of it will be live, but Zoom does do a recording. So does anybody have any questions? And also, I just thought of it too, that tally sheet. Make sure to keep that tally sheet ongoing. It's an ongoing fluid document. I strongly suggest to meet, You know, I have a group back of the hill from 8 to 9. This is class time. After 9 o'clock, I can bop into other groups and answer any questions so that we can get started. So I strongly suggest to meet. It is your class time, and use it effectively. It's amazing how fast the weeks go.
And this is exactly what we would be doing if we were, you know, in the classroom in person. We would be, you know, separating out into the groups and meeting.
Yes. Yeah, most definitely. Yeah, exactly right, Miss Byrne.
Okay. Dr. Laspina, Dorina asked, is this for next Tuesday?
This is for Tuesday, September 22nd. Yes, next class. Group planning. Right on. It's posted in Blackboard. It's also posted on that calendar of instruction. I always like to talk about things the week before. So Thursday, a week from today, September 24th, will be chapter 8. There will be a quiz. I will have a quiz for you so that you can get another incentive points. Okay, and I'll post that. So chapter 8 will have a pre-quiz, and that's next week. And each class time, we try to allow enough time for you to also work. But please know, once you really start getting deep into your project, many students work outside of class time too. Any questions at all from our announcements or what's going forth? Okay. We do have one other, and I know Ms. Holloway, if you would like to talk about the book discussion, because we are now at week 4. Right, and I know.
So on weeks 4 and week 7, we will be reading excerpts from the book Teeth. And that a link to that will be included in the Blackboard so that you can find that in your MCPHS library. And then there will be questions from the ADHA study guide about the book for you all to work in the discussion board in Blackboard. And there will be a rubric posted. I believe the requirements that I put on there is that it has to be a minimum of 150 words. Your original post is due by Wednesday of week 4 and week 7 also. We'll have 2 discussions. And then by the following Sunday, you will need to respond to at least 1 peer. For the peer response, there's no minimum word count. It just needs to contribute to the discussion. I don't want just, you know, yes, I totally agree that's, you know, a great response. I actually want you all to discuss things together to know that you are learning from the book and gaining knowledge that's going to help in your career. But the questions are very simple, I believe, and they reflect a lot on personal experience. So it should not be anything difficult. But if you have any questions as we get into week 4, then you can always email either myself or Dr. Laspina or Ms. Byrne.
Yep, it's amazing. It's quite powerful book. It's very impacting. So it's really gonna, when I read it, it does make you aware of what's going on in America as far as oral health. So I do hope that you enjoy it and you know, realize what are the challenges. It's real. You know, it's not far from us. It's happening right in Boston. So, you know, such a city that has so many dental opportunities, and yet it's still not enough. So this is what really opens up in the book, the challenges. So I do hope you know, and you certainly, you know, in your spare time, if you want, you certainly can read other chapters because, like I say, it is very impacting. So Ms. Holloway, I'm so glad that you're bringing this forth. And what we can do is, I used to call it the sidebar, but it's called the menu tab on the side. Mm-hmm. We can put the book, we can say teeth, and that's how students can get into it.
Okay.
How's that sound? That way it would just be easy.
Right.
For them. So, well, great. Any questions at all? Well, we will send an announcement when that's all put into Blackboard for you so that you know. Okay, then if we are good and there's no questions, Ms. Holloway, you're more than welcome to begin on your presentation this morning.
Okay, wonderful. Good
I did-
morning. And first of all, I want to say congratulations on your first exam. I looked over the results of the exam, and I don't know if Dr. Lespina has already made that public to you all, but you all did very well. The results from that were wonderful. But today we'll be reviewing Chapter 5, which is Population Health. And before I start on our PowerPoint and the lecture for today, I want to go over the pre-quiz that you all did so that you have the correct answers. And as we progress through the PowerPoint, if you have any questions about those answers, then you can ask them at that time. So I will share my screen for the quiz. Okay, can you all see that? Yes, okay. I may need to make it a little bit bigger. Okay, so question 1 was all of the following are factors that contribute to the burden of oral disease except, and household size was the one that was not a factor. So literacy level, poverty, unhealthy lifestyles, and that includes smoking, alcohol consumption, many other things that we'll discuss in the lecture, and then the lack of oral health education. Question number 2 was dental caries is the single most common chronic disease of childhood, yet it is completely preventable, and that is true. Question number 3 is oral disease can impact a child's life in numerous ways. Which of the following is not caused as the result of untreated oral disease? And that would be poor sleep patterns. And no doubt that may be something that does affect children, but according to the text and the research that has been done, that is not one of the factors that's included. Those that are included are school performance, poor self-concept, delayed growth and development, and difficulty eating. Which of the following is false regarding water fluoridation? And that would be that all communities are equally fluoridated. That is not true. Water fluoridation is cost effective. It is related to major decline in dental caries. It benefits Americans of all ages, and 0.7 parts per million is the optimal recommended concentration of fluoride in water. Question number 5 is which of the following is not true of teledentistry? And that would be that California and New York are at the forefront of telehealth technology. It is actually California, Alaska, and I have to look at the other one. I believe Minnesota, but it's in the lecture. But it is not New York. And the other statements that are true about teledentistry is that the goal of teledentistry is to bring oral health care to hard to reach areas and expand access to care for underserved populations. Teledentistry can enhance early diagnosis and treatment for oral disease. Non-dental providers such as dental hygienists and mid-level providers are used to increase the available workforce for teledentistry. And now that I read that, I see that non-dental is a little bit confusing, but that means non-dentist. So dental hygienists and mid-level providers are used for teledentistry. Question number 6 is that the highest risk factor for oral cancer is, and that's the combination of smoking and alcohol consumption. All of the others are risk factors, but the highest is the combination of smoking and alcohol. And the final question was, evaluating a specific oral condition at a certain point in time is a status, and then tracking direction of each objective over a period of time can reveal a trend. So we will review that in the PowerPoint today as well. Any questions so far? And I cannot see the box.
Ms. Holloway, we are good. Yep, there's no questions yet.
Okay.
Thank you.
So for the PowerPoint, I'm going to share my screen, but I also have a separate screen of notes. So tell me if you cannot see the PowerPoint clearly. I can always get a different device to put my notes on.
We do not see it yet.
Okay. there's the PowerPoint screen. And when I pull up my notes, can you see my notes also, or can you only see the PowerPoint screen?
We can only see the PowerPoint slide.
Wonderful, wonderful, okay. So for chapter 5, it is population health. Our learning objectives for today, after reading the chapter and attending today's session, you should be able to describe the burden of oral disease both globally and nationally, identify oral health indicators from Healthy People 2020. We will also discuss the oral health objectives from Healthy People 2030. That has been released recently, so it was not included in the text since the text is a little bit older, but Dr. Laspina has told me that the author of the textbook will update her text and include Healthy People 2030 when the new book is released.
Yeah, and that happens. That's why it's difficult with, books for public health, because the data changes so quickly. But the basic principles are all there. But yes, you're right, Ms. Holloway, a new book will be coming out next year, 2021.
You will also be able to describe the social effects of oral disease, discuss status and trends for oral health in the U.S., explain oral health disparities and inequities among different population groups, describe the enhancement of workforce capacity and improving access to oral health care using teledentistry, describe the infrastructure and capacity of dental public health programs as well as future outlooks, discuss influencers of oral health among different population and recommendations for future changes to improve access to care. And finally, you'll be able to discuss options for a basic community health plan based on differing at-risk populations. So as we all know, oral health affects total body health and is an indicator for quality of life. Oral health problems are a global issue that affect 3.9 billion people. The burden of oral disease is present among different age groups, ethnic groups, and in both developed and developing countries. Untreated dental caries was the most common condition of the almost 300 diseases, I believe it was 291 diseases, that were included in the Global Burden of Disease study from 1990 to 2010. Up to 90% of school-aged children and almost 100% of adults have experienced dental caries at some point in their life. Up to 20% of adults have periodontitis. 30% of older adults are edentulous, which means they have no remaining natural teeth. Oral cancer is the 8th most common cancer globally. 25% of birth defects are craniofacial malformations. Oral disease is a greater issue for those with lower income, lower educational levels, and disadvantaged groups in developing countries. Over the 20-year period that was studied, there was a 20+% increase in the global burden of oral conditions in that 20-year period. Population growth and aging contributed to the increase for that. The important thing to remember about these oral diseases is that they are preventable with proper care. The lack of oral health professionals and absence of advocacy for oral health programs within some governments is a major contributor to this global burden. The impact of preventive oral health programs is reflected in the patterns of oral disease between different countries. So for oral health in the U.S. has made major strides to reduce the extent and severity of common oral diseases, yet the diseases are still common and very widespread. Dental caries is one of the most common preventable chronic diseases in our country. The U.S. uses the Healthy People system to set objectives for improving the health of the public each decade. The objectives are based on the current health status of the nation. There is an oral health section of objectives each decade. The outcomes of the objectives from the previous decade become the basis for the objectives of the next decade. The system allows the nation to continually progress toward targets and set new objectives. Specific population groups in the U.S. have profound oral health disparities despite nationwide improvements in oral health status. Social characteristics that are associated with oral health disparities include income, education, race, culture, geography, age, sex, disability status, and behavioral lifestyles. Poverty, literacy levels, oral health education, and unhealthy lifestyles like poor nutrition, poor oral hygiene, tobacco use, and alcohol consumption all contribute to the national burden of oral disease. The poor in each age group are more prone to oral health issues. Ethnic minorities, the medically compromised, and those with disabilities are at greater risk for oral disease compared to the rest of the population. The lack of dental public health programs or inadequate facilities also contribute to the national burden in some communities. Oral disease affects growth, self-concept. Let me get back to my notes. The capacity to learn, economic productivity, the ability to work, and school performance. I have the wrong screen up. Let's see. Can you all still see the PowerPoint? Okay.
Yes, we can.
Okay. The capacity to learn, economic productivity, and the ability to work and school performance. Untreated oral disease can also result in premature death. The table shown on this slide from page 109 in our text lists several examples of social impacts of oral disease in children and in adults. So some of them that we're not surprised by is that, or at least that I was not surprised by, as you advance through your career, you may see more of this. But for children, they experience delayed growth and development. They have poor self-concept. They avoid talking. I believe that is because of one, pain, but also embarrassment from the untreated dental conditions. They have poor school performance. They miss school. They avoid smiling, and they experience difficulty eating and drinking. For adults, they experience impaired oral functions, suffer disfigurement, have poor work performance, they lose work hours, have difficulty speaking, they're affected by poor nutrition, and they endure stress within the work-family relationship. The text defines status as the current state or condition, and it defines trend as the direction of a condition on a particular course over a period of time. As for the status of dental caries in the United States, coronal and root surface caries are higher in other countries, but there's still a high rate of both treated and untreated decay in our country. Despite the national decline of dental caries in school-aged children in the 80s and 90s, tooth decay is still the most common chronic disease of childhood. Efforts like community water fluoridation, increased use of other fluorides, and application of dental sealants did aid with the decline of caries for this age group. However, the prevalence of untreated caries has increased more than 18% in 3 to 5-year-olds and more than 4% in 6 to 9-year-olds between 2000 and 2010, and that's based on the data from Healthy People 2010.
You know what, Ms. Holloway, too, and everyone, is it's going to be interesting to see the new Surgeon General's report, because he's going to be talking about older adults, because the root caries for older adults, you know, research is coming out that it's just skyrocketing. So I can't say enough. I tell people, because the older adults, they'll kind of laugh at you when you'll say, oh, fluoride, I used to have that when I was a kid.
Yeah.
You know, and they laugh and they think it's great because it brings them back to memories of when they were a child having fluoride. But I can't emphasize enough how important it is to keep always making sure that you address fluoride with each patient. And how I would always do it is I would say to them, what is your fluoride source? Some people, the adults will look at me like, what? But as you know, a lot of people are using bottled water, and we don't know what's in that bottled water.
Just this week, I had a patient in her mid-30s that I recommended a fluoride treatment for. She unfortunately had rampant decay, hadn't been to the dentist in more than 10 years. And so when I recommended fluoride, she said, is that beneficial for adults? Don't children typically get that? And so I had to educate her about that, which was a little bit surprising given the area that I work in. I work in a more high-skill area of Georgia, with the income being higher than it is in other areas, and she had a very respectable job and, you know, looked nice, carried herself well. So it was surprising that she didn't care for her oral health.
Yes. And you know what? That happened to me too one time in private practice. The mother actually was an attorney, and she had a 3-year-old daughter. And she didn't want to brush the 3-year-old daughter's teeth because the daughter cried. So, you know, it is important, no matter, you know, the population, to educate. Your jobs are very important to educate.
Absolutely. So there has also been an increase in untreated decay in adults in the U.S. That increase was nearly 4% over the last decade, based on the text that, again, as Dr. Laspina said, that has likely changed since we're getting new information every day. Healthy People 2020 included objectives to reduce decay in each age group. Preventive efforts like placing dental sealants has increased based on data from Healthy People, but still needs to increase further to continue decreasing the risk for decay. Community water fluoridation is a crucial public health preventive service in our nation. It's equitable and cost-effective, as we reviewed in our quiz from this week. Over the past couple of decades, there has been a steady increase in the number of U.S. communities served by fluoridated community water systems. Studies show that communities with fluoridated water supply had fewer decayed tooth surfaces compared to non-fluoridated communities. And again, as we discussed on the quiz, the optimal recommended concentration for fluoride in the water is 0.7 parts per million. That is not the actual parts per million in each community, but that is ideal or optimal. Periodontal disease, including both periodontitis and gingivitis, is another oral condition that's plaguing our nation. In 2010, more than 47% of adults aged 30 and over had periodontitis, and nearly half of young adults had gingivitis. Periodontitis, it was higher among men, Mexican Americans, adults with less than a high school education, those below poverty level, widowed individuals, and smokers. Edentulism and partial tooth loss has decreased over the last century. However, the more recent increase in untreated decay has caused an increase in partial tooth loss. Age and poverty level status are major factors impacting tooth loss. For oral cancer, 2.5% of new cancer cases in our nation is oral and pharyngeal cancer. Early diagnosis of these cancers increases survival rates. So I'll just add that this is why it is so important to do our intraoral, extraoral exams. I feel like a lot of hygienists lose that when they move into private practice, but it takes less than 5 minutes to do that for each of your patients. It is very, very important to check for those things because, as I said, if you catch those cancers early and are able to diagnose them, the survival rate increases greatly for those patients. Risk factors for oral cancer include tobacco use, alcohol consumption, contracting HPV, and chewing betel quid. The betel quid is common in Southeast Asia regions, but so it's not so much of a concern in the U.S., but it is important for us to know because we do have such a diverse nation, and it is possible that you would treat a patient that does have that habit. The combination of tobacco and alcohol use together poses the highest risk for oral cancer. So now that we have briefly reviewed Healthy People 2020, there are some links posted in our Blackboard for Healthy People 2020 and 2030. I would like you all to break into groups. We'll do the breakout rooms and look at the differences for 2020 compared to 2030. Find several of them because I would like to hear from several groups. So if you have the same answer as another group, I'd like you to give a different answer. There are several things on there that are different. So we will do that at this time. If Dr. Laspina, if you can do the breakout rooms, I'm not sure that I have the access to do that. I may have to stop sharing my screen. There we go. Any questions about that before you go to your breakout rooms? Oh, and we will come back at 8:45. I will type that in the chat box as well. come back at 8:45 and we will discuss that. Education and public awareness in the same manner as telehealth and telemedicine. This allows oral health care services in underserved populations and hard to reach areas. We covered that in our quiz questions that we reviewed earlier. Teledentistry also increases workforce capacity, increased interprofessional collaboration, and enhances early diagnosis and treatment for oral disease, which, as we discussed earlier, is very important, not only to decrease the risk of death and increase survival rate, but also to save teeth, to prevent dentalism and dental caries, preventable dental diseases. Early treatment diagnosis. Alaska, Minnesota, and California are at the forefront of telehealth technology. In order to continue moving forward with oral health care, these focus areas should be considered: conducting surveillance of oral diseases and conditions, reporting the burden of disease, facilitating the development of implementation of oral health coalitions, careful and far-sighted planning of oral health initiatives, implementing dental sealant programs, coordinating and monitoring community water fluoridation, managing program capacity and infrastructure to sustain a dental public health program, increasing capacity of the workforce to support programs, and focusing on comprehensive evidence-based oral health education aimed at improvement of preventive oral health behaviors. So some of those we are already doing. We already have community water fluoridation, but there are some communities that don't, so that needs to be increased. There are dental sealant programs, but again, can be increased. The reporting of the burden of disease, Healthy People 2020 contributes to that, and Healthy People 2030, every decade that it's updated. But again, we just still need continued further information in order to increase access to care and meet unmet treatment needs for our entire population, both globally and nationally. So that is the end of our PowerPoint for today. I am going to stop sharing my screen. Does anybody have any questions about anything that we have covered so far today? Anything about the quiz that we reviewed the questions on, our activities for today? Anything? And again, feel free to turn your microphone on if typing is not going to be quick enough for you. Okay, if not, thank you for your attention. I'll see if Dr. Lespina or Ms. Byrne has anything. Our guest speaker is going to be in 30 minutes, so if you all don't have anything else, they can go into their collaborate rooms if you'd like them to.
Yep. Thank you, Ms. Holloway. That was a wonderful presentation. Thank you so much. You know, very informative, and we can see how important Medicare, Medicaid is. It's key. And especially Medicare, they're really working on that to see if they can have those dental benefits provided for our older adults. So, yep, awesome. Okay, yep, they're saying thank you. So yes, we do have our speaker coming at 10. So if we can go in our breakout rooms, you know, I think perhaps take a 10-minute break. You can go into your breakout rooms, and then everyone should be back at 9:55 into this room, into the Zoom room. Okay, I want everyone back. That would be great. At I'll put that, should I put that in the chat? 9:55. We want to be back to listen. You'll enjoy our speaker also from the Office of Oral Health. She tells you what's going on in the state of Massachusetts, and she'll also tell you about working in a community health center. So, anybody have any questions? Okay. Then if you don't, let's say, you know, about 9:40, be back. You can work collaboratively in those rooms, you know, maybe work, you know, revise the surveys, and then At 9:55, we'll be back in this Zoom room. Okay. Well, thank you again, Ms. Holloway.
Thank
That
you.
was terrific. Thank you.
Thank you.
All right. Sounds good. Bye, everyone. And Ms. Holloway, and Ms. Byrne, do you want to come back to the room a little sooner too? Because I just wanted to mention a few things too. Maybe like 9:50.
Sure.
So eventually there'll be a new submission link for the survey revisions. You know what? Great question, Hannah. Just send it to me in an email. You do not need to post that back to Blackboard. You did the initial, so just send it to me in an email. That would be great. Your group, and keep everyone in the group. So, good. Yes, you can send it. Thank you. And you'll spread the word. Thank you, Hannah. All right, perfect. Okay, I'm just going to draft an email. So about 9:50, we'll be back. All right, thank you. Hello, everyone. How's everyone doing?
Fine. How are
That's
you?
good. Yes, good. I just want to say how nice, like I said, you did such an awesome job.
I
You
know it. Great job.
And sometimes, and this is totally up to you, sometimes students, graduate students will make a survey, and you are
Okay.
more than welcome to see for feedback. We can
Yes.
implement it in Blackboard, and I certainly will give like an incentive point that can go towards the next exam.
Wonderful. Okay.
So,
Yeah.
do you know how now to implement a survey? It is anonymous. You won't know. Students can provide feedback. I would just, a lot of times it would be like 5 to 6 questions,
Okay.
simple questions that they can answer.
I don't know
So,
how to do it in Blackboard, but I'm sure I could figure it out.
and I can certainly show you right after class if you'd like.
Okay. That works.
Yep, we can bring it up. And then the discussion board now, are you comfortable setting that up?
Yes. Yes,
Okay.
absolutely.
Yeah.
And everything that I sent you is okay? You didn't see
Oh,
typos?
yes, I
or
liked
anything?
it.
Okay.
Yeah, it's nice. It's a nice reflection. And I like how you started it and how the last question is. Yeah.
Okay, good.
It's going to really help them realize the importance of why they chose this profession, reflecting on it. So, yeah. No, I thought that was great. Yep. Yeah, so that's awesome. Yeah, that's all. Anything else any other questions that you have, anybody?
I think so. Not right now. Anyways.
Okay, all right. We're just gonna wait for, let me see if Brittany, nope, I don't see Brittany here yet. Let me see. Brittany Brown. Nope, I haven't seen her. I'm watching my phone too, just to make sure, because you know what? Technology, as you know, sometimes it can cause concerns, right? Oh, yeah. Okay, so we'll wait on that. Yeah, I can't believe it's Thursday. I just can't believe this week just flew by. Okay, so question was, do we submit the revisions for the survey or just one person? So Brittany, everybody, you'll send one email to me with the survey, but all your team members need to be on that email. So all your team members will be in that email, and you're going to send me that survey. So. Okay, just a couple more minutes and sure she'll be joining. My little Scrappy Doodle's not doing too well today. I don't know. We'll have to see. My little guy.
What's wrong, Lisa?
Yeah, I don't know. He's vomiting. So
Oh,
I brought him
no.
to the doctor's last night, and we'll see. I'm gonna get test results today. So hopefully,
Oh, my gosh. I hope he's okay.
yeah,
The poor little guy.
right. I know.
I think you can probably hear my Finn in the background. I don't know what he's doing over there.
I
I
heard
get.
the collar shaking or something.
I have every bone in the whole house in here so that they have something to play with. And he's like playing with all of them at the same time. Oh, now he's jumping on the other dogs. Uh-oh. I'm gonna have to mute my mic pretty soon.
We bought all of our dogs little, it's like stuffed animals, but they didn't really have any fuzz in them. They were just really flat, but they were all squirrels. And our female Great Dane got all 4 of them. She took everybody's toy and she had all 4 of them in her mouth at one time. She was not sharing the toys. It is so cute. And she'll just walk around with all 4 little squirrels hanging out of her mouth.
Oh boy. Yep.
It's cute.
Finn does that too. He'll take one ball in his mouth and then he'll lay on everybody else's ball. So it's like,
So funny.
yeah, sorry, you can give a ball to everyone in the whole house, but I'm going to have all of them. Silly dogs.
I know, they're so sweet, but yeah, I'll get test results today, so hopefully everything will be okay, but oh my goodness, I'm just checking my emails to see. Okay. Almost. Anybody have any questions from the students? We'd love to hear from you. Any questions? Any questions?
Hi, Brittany. How are you?
Oh, she joined. Oh, there she is. Oh,
Hi,
yes.
how are you?
Oh, hi. How are you, Miss Brown, this morning?
Oh, thank you.
That's good. Very good. Well, we're so glad you're able to join us.
I'm happy to be here as always.
I was telling the students how you know, are a former student, but of course you can tell them. And I remember Miss Brown in Bay 3B. I say it all the time.
The whole 3 years.
I know. Isn't that funny how that happened?
Mhm.
I know it. And yeah, so welcome. And you're more than welcome to, you know, you can tell them your story, your career path, and where you all began and where it led you and all the good things that Massachusetts is doing. So,
Excellent. That
thank
sounds
you.
great. All right. So good morning, everyone. As Miss Laspina said, I'm Brittany Brown, and I'm currently the director of the Office of Oral Health at the Massachusetts Department of Public Health. I graduated from Forsyth in 2013 and have basically been at the department ever since. So during my final year at Forsyth, for my capstone project, I did some work with the Department of Public Health looking at their school-based fluoride mouth rinse program. And doing a lot of the administrative work and the paperwork for that. And I've kind of just stuck there ever since. So after I finished my capstone project with them, they reached out like a week later after graduation and said, "We have an open position. Do you want it?" And I was like, absolutely yes. So finishing up at Forsyth, you know, doing the clinical work, I was very much interested in oral health, but I just didn't know if I could see myself being a clinical hygienist, you know, every day of the week. So I thought this was a really great opportunity. And I started doing work in the community water fluoridation arena, as well as with their school-based dental sealant program. So right off the bat, it's a lot of variety in the work that we do there. And I was very, very appreciative of that because I was doing school-based work, but also some administrative work as well. So Department of Public Health, as you know, a variety of work that we complete that I was able to, not just oral health work, but chronic disease work, vaccination work, all sorts of stuff that's related to oral health that I've been really working to make the connections on there. So I started, as I mentioned, at DPH working in community water fluoridation. And then I soon moved on to working on a grant related to medical dental integration in community health centers. And then about 2 years later, I stepped into the role of the director of the Office of Oral Health. The Office of Oral Health is extremely small. It's myself. We have a full-time program coordinator on a grant and also on community water fluoridation. And of December of last year, we just brought on a part-time dental director. So the office actually employs a dentist now to really focus on some of that clinical initiatives and the work that dentists do. So just to jump in a little bit about the Office of Oral Health. So our vision is to eliminate oral health inequities in the Commonwealth, and the Department of Public Health has a huge focus on racial justice and racial inequities. So we really want to make sure that our work in the Office of Oral Health aligns with that. And our mission is to improve and maintain oral health and ensure equitable healthcare access for all Massachusetts residents. And we do this through a variety of different ways. We provide education around oral health and its connection to overall health, and we assess oral health needs in the public and also work to implement evidence-based strategies for overcoming those access issues. As I mentioned, medical dental integration and making sure that people understand that oral health is overall health is really important. And we couldn't do any of this work without our really strong network of stakeholders and community-based providers to help us carry out this work, considering that, as I said, we have a very small office. So a couple of different categories that we've worked in, which I've kind of touched upon, are portable dental care and school-based dental care, the fluoride mouth rinse program that takes place in schools. We have a couple of grants that we've focused on around access to oral health care, oral health equity, and perinatal oral health. And we also do work in the community water fluoridation arena. So in terms of oral health workforce, we work with the Healthcare Workforce Center at the Department of Public Health to actually produce reports on the workforce for all health professions in Massachusetts, not just dentists and dental hygienists, but them as well. And this information all comes from licensure surveys. So when you go ahead and apply for your license and renew your license as a dental hygienist, you'll get a survey with a series of questions related to where you're practicing, what kind of services you provide, your education level, how long you plan on practicing. And that really helps us formulate kind of where the gaps in access are and where they might be in the future, considering retirements and change of career and things like that. So that's a really important way that we figure out where people are practicing and who needs access to care. And then so another really important thing that we do is portable dental care. So there are a variety of portable dental providers in Massachusetts, both public health dental hygienists who you may or may not have learned about or even met yet in your programs, but there's about 29 dental hygienists who are licensed in Massachusetts and also have the permit to practice as a public health dental hygienist. So basically what that is you have to be a dental hygienist with 3 years of experience, and then you take a 3 or 4 hour course on basically what it is to be a public health dental hygienist. You do some observation hours with a portable dental program, and then you work with the dentist who becomes your collaborative dentist. And from there, you're able to provide services in a variety of public health settings, including schools, daycare centers, long-term care facilities, nursing homes, really anywhere that's considered a public health setting. So really these programs drag in portable dental equipment and provide all sorts of services. The majority of portable dental programs provide only preventative services, but there is one program in particular that actually has dentists comes out and they do minor restorative services. So this is really, especially in schools, it's taking the parents out of the equation in the sense that they don't have to bring the child to dental care. Dental care is coming to the child. So it's really working to break down some of the barriers to dental care. And over the past couple of years or so, every year about 20,000 children alone are served by portable dental services. So it's an extensive amount of children who might not otherwise be receiving services at all. So it's a really important initiative. And as you may or may not be aware, there is another provider type in the United States, not everywhere yet, but the dental therapist or advanced dental therapy. In Massachusetts, we don't have this type of provider, but there is a bill out there to create one. So maybe one day soon we'll have one in Massachusetts as well, who again will help increase access to dental care. And then, so as I mentioned, we also work on community water fluoridation. And as you may or may not have learned already, community water fluoridation can be a contentious topic in public health and in communities. And at DPH, we are responsible for collecting community reportings for community water fluoridation. So if a community does fluoridate, they are required to submit daily, weekly, and monthly levels to the Department of Public Health, just so we can ensure that they are fluoridating at the optimal level for tooth decay prevention. And if there are any technical issues or product issues, we can connect them with resources to get those mitigated. So in Massachusetts, we have about 138 communities that are fluoridating in one way or another, whether that's through their community water system in the town being fluoridated, if they're purchasing fluoridated water from another community. There's a whole lot of ways to do that. So community water fluoridation in Massachusetts, unfortunately, we are not doing very well when you compare us to other states. So some states, you know, they have mandates in place that require communities with populations over X number of residents to be fluoridated. But in Massachusetts, we leave community water fluoridation up to each community so they can decide if they want to fluoridate or not. So we do have a ton of other communities that have the ability to fluoridate who just have not started the practice. And then, as I mentioned, when I started at DPH, I worked on our school-based fluoride malference program, but unfortunately that program has ended nationwide, not just in Massachusetts. So there was one production of fluoride malference in the country, and that company has decided to discontinue the product. So what we're looking to do is extend the use of portable dental programs in the place of this fluoride malference program. Some of you may remember it from when you were in elementary school. I sure do, and I absolutely hated it, but now I see the value in it, of course. But I remember it's the weekly swish and spit program that you would do right in the classroom. So we actually saw it in action when I was younger, which was great. And as I mentioned, we do a lot of work with grants. So we receive state money at the Office of Rural Health, but we also rely on federal grants as well. And with federal grants, it's usually pretty particular on what you work on. So you have to pick an area that they're interested in, that you can actually make come to fruition in the state. So one that we recently worked on was perinatal oral health. So increasing access to care for pregnant women and young children. And what we did with that project was, one, create perinatal oral health guidelines. So what those are is just a really brief document about what pediatricians, OBGYNs, and family medicine providers should do in terms of oral health when they see their patients. So whether that's applying fluoride varnish in the pediatric setting or making referrals to dental care when you have a pregnant woman come into your office. So really kind of the basics of what you should do. And then from there, our project focused on actually implementing those guidelines. So you can have all the guidelines you want, but if you're not going to use them, they're really not effective. So we worked with 5 community health centers to actually integrate perinatal care into oral health care. So referrals from the OB or family medicine provider to get dental care. Same thing with the pediatrician, making sure that children were getting to their age 1 dental visit. So really making that direct connection from overall health to oral health and getting people into dental care. I mean, it could be as simple as, you know, the dental office is right across the hall from the medical provider office, but people still weren't making that connection or getting there. So really giving that push to get into dental care was really successful, and we learned a lot. But again, there's still a lot of confusion around whether or not pregnant women should get dental care or at what age children should get dental care. So just because the grant ends certainly does not mean that the work ends, and we continue to push this forward. Another grant that we are currently still working on is the Oral Health Equity Project. And the goal of that project is to increase access to dental care for Hispanic and Black youth age 0 to 14 in 2 communities in Massachusetts. So basically what this was a pilot project. So we worked with Holyoke and Worcester, and we worked with the schools there, the community health centers, and the early intervention programs there to make sure that there was a connection between these programs and dental care. So whether that was a screening questionnaire to see if they've had dental care and then making that referral, or school nurses working with portable dental programs to make sure that kids are getting in and seeing there. So really just raising the level of oral health overall in terms of medical care. So for instance, when kids enroll in school at the start of every school year, it's asked if they have a physician or if they've had their physical and vaccinations, yet nothing is said about oral health. So we're really trying to make that kind of equal importance to everything else. And then another grant that we've currently are working on is a state oral health workforce grant. And the purpose of that grant is to increase access to oral health care in places that don't have as much oral health care. So we're working with 3 community health centers to increase access in any way that they really see fit for their communities. So one of these community health centers actually purchased portable dental equipment through this grant and started a dental clinic in a community health center that did not have dental care. So they actually switched over 2 medical rooms into dental rooms. So dental is placed right in the medical practice. Another one of these community health centers did not have dental at all, but they started a referral system with a community health center down the road that did have dental. So they're actually doing referrals back and forth between 2 different community health centers. And then the third of these community health centers created a connection with their Head Start program. So Head Start is required for their children to have dental visits within 90 days of enrollment. So what this community health center did is they brought in dental residents to do those screenings, and then from there they actually connected the students back to the dental care at the community health center. So it wasn't just like, okay, you have your screening and now you're good. It's now actually, let's get you into a long-term dental home. And then another really big part of that grant, which is particularly important now, is around substance misuse. So training dental providers to screen for substance misuse and for them to actually help facilitate treatment and get them into care when they're identified. So another really important piece that's underway with this project. So we actually started a learning collaborative with quite a few community health centers so they can sit through trainings and learn more about how to do this work, and then from there actually implement it. And then I think one of the most applicable to you all right now is loan repayment. So as a dental hygienist, once you get licensed, and this is true for other health professions as well, if you find yourself working in a community health center or a high need area that has limited access to dental care, you can apply and potentially qualify for a loan repayment. So there are 2 different programs. One is state run and one is nationally run, and I can send over these links for more information. But there's the Massachusetts Loan Repayment Program that, like I said, if you find yourself in a community health center or a high need area working, you can receive up to $40,000 for a 2-year commitment to work in these areas. So basically you have to have the job first and then you apply. But a really great program, and I will say that I help review the applications, and we see very few applications from dental providers, so you certainly stick out in the group when we do see them. And then there is a national program called the National Health Service Corps, which does the same thing. The loan amount varies for dental hygienists, but it's another great opportunity to serve a community that needs the dental care, but also help pay off some of your student loans as well. And I will say, I usually get the question, do you also get a salary on top of this loan repayment amount? And the answer is yes. So you get your normal salary, and then you'll get a check that'll go right to your loan provider. So it really is a significant help paying off your student loans for sure. And we find that a lot of people who do this work absolutely love this work, and after that 2 years they don't want to leave. They've built a life in the community that they're serving, and that's really the purpose of all of this. So if you have a dentist or a dental hygienist, serving a community that you now live in and love, that you will start a practice and stay there. So I just saw a question this just for Massachusetts? And so I think every state has the equivalent of the Massachusetts loan repayment program. It might be named something a little bit different, and it might have different dollar amounts, but this happens everywhere. They're just separate from this. And as I mentioned, there's also a national one. So 2 different ones there. And then another question, do you know if people are actually successful at getting loan repayment? Many fields are eligible, but never actually receive the benefit when they apply. So I know for the Massachusetts loan repayment, we certainly see, we go through a review process, reviewing applications, and we know that people are successful kind of getting that check to pay off their student loans if they're doing that 2-year commitment. So I think it's definitely, I can speak for the Massachusetts program and say it is successful for sure.
So Brittany, I just wanted to mention that one of our adjunct faculty out in the Worcester campus works in the community health centers out there, and she had her loans paid back for her bachelor's, and then she continued on for her master's, and she had her master's paid for as well. So and she still has stayed, many years later in the community health center, and absolutely loves it, and takes our students for rotation there as well. So which is great. And every student that comes in, she says, she tells them about this program. She tells them how much she loves the community health center, in hopes that more will apply. And then the other thing with Erin's question about, is this just for Massachusetts? Can you if there isn't an Office of Oral Health in another state, or do you know if there are in the New England states, Brittany?
Yep. So every state in the country has an Office of Oral Health.
Okay, so they should, if they're interested from another state, they in these kind of programs, they should reach out to Google those. Yeah.
Yes. Yep. Those will come up right through a Google search. It's unclear whether in every state the actual loan repayment program is run by the Office of Oral Health or their equivalent of a health kind of office there. But I think the Office of Oral Health will certainly be able to point you in the right direction if it's not them. So.
Perfect. Thank you so much, Brittany. I'm sure that's helpful for the students. Thank you.
Sure, yeah. And just to follow up on what you said, that's a prime example of what we want to see a loan repayment recipient doing. So as you mentioned, so if you do your 2-year commitment and you find yourself still working there, you can apply again and get another 2 years. So if you're working in that area and still enjoy it, you can certainly continue on and get the funds again. And it's great that she's bringing in students and everything else. I mean, I feel like that is the star example of how this program, we're hoping it works. So that's great.
Such a
And so
wonderful
I
opportunity.
think I've covered everything. So if there's any questions from anybody, I'm happy to answer them.
Right. Such a wonderful opportunity, not only the loan repayment, but the experience alone, working in community health centers.
Absolutely. So I think a lot of people who start working there find that they never want to leave, because it's a population that needs the care, and it's such rewarding work that you don't want to go anywhere else. So it's really great.
Yeah.
Some of our students will be going with me on rotation to the Whittier Street Community Health Center, so they'll get some experience there as well, and maybe they can talk to some of the other providers there. I mean, it's as we all know right now, there are a lot of hygiene jobs available. So maybe they can make some connections.
Definitely, yeah. And I will say, I can send this link along as well, but the Massachusetts League of Community Health Centers, they work with all the community health centers in Massachusetts. So they have an up-to-date list of jobs that are open in these community health centers that would qualify for loan repayment. So if this is something you're interested in doing, I would highly suggest looking there, but I can send that information along too.
Yeah,
that would be great. Yeah, and maybe Dr. Laspina can.
I'll post it.
Post
that. I'll post it right under. I have guest speaker. So with your information, Ms. Brown, there. So I will post it right there. So,
great.
Yeah, that's great. Yeah, there's so many nice projects that they're doing in Massachusetts, and it's wonderful how you started with your capstone. Right, it just opens up a door that sometimes we don't realize until we're exposed to these encounters that it's something that you would enjoy to do.
Absolutely. I mean, I certainly was not expecting to work at the Department of Public Health before my capstone. I thought I was going to be a clinical hygienist, but here I am. 7 years later
we're
now,
so
I
proud.
think.
We're so proud, Miss Brown. We are very proud
I
of
can't
you.
believe it's been 7
I
years,
know.
Brittany. What the heck?
I know, it's crazy.
Time goes by, but we're so proud of you. That's wonderful.
Yeah.
And I think this opens, maybe opens the eyes of some of the other students here that there are some other opportunities out there. And, making these connections while you're in hygiene school is very important. It really is.
Absolutely, yeah. And I think if I had gone to any other hygiene school, I probably wouldn't have had the opportunity. Just being right in Boston really opened up a lot of doors. So definitely.
Well, I think the 2-year programs don't do a capstone project anyway, so that that is true. That you have some great experience, and the students haven't done their capstone yet, Ms. Brown. It'll be next semester that they'll
Okay.
be they'll be doing their capstone project, but they're hearing a lot about it, and all kind in our classes, as well as through you. So that's great.
That's
Yeah.
great. I would
Right.
say definitely look for something you don't think about often, kind of open your horizons, do something different. It's a great experience. So.
Yeah. And, it really, there's so many doors open for a Foresight grad,
Absolutely.
it can be a nice mix. I mean, you can do clinical work part-time, but then you can do something else too. Another door.
You know what, Ms. Brown? Why don't you didn't talk about what you're doing now, because aren't you in a master's program right now?
Yes, I am. So
why don't you talk about that a little?
Final semester of my Master's of Public Health at UMass Amherst. So I will be done in November if all goes well. But I remember even being in hygiene school, chit-chatting with one of the instructors, and they were talking about like, oh, what if you want to go back to school after this? And I was like, that's not happening. But here I am now. So, I just figured I was working in public health with no education-wise public health experience. So there was a lot of words flying around that I wasn't quite sure what they meant. But so here I am now in the master's program, and I think it'll give me a lot of that kind of background, like statistical epidemiology, like all of that stuff that I hear and learn about, but don't really have a formal education in. So you'll be surprised where you end up 7 years later when I never thought I would go back. But
All right. That's awesome.
yeah.
And this class just teaches just the basics, just the beginning of just an intro of biostatistics and epidemiology. So sometimes students are surprised. They're like, well, gee, I really like these topics.
And I would say public health, we love data because, I mean, how do you run a program or know it's successful if you have no way of proving it? So I've learned that data is so important for sure.
So true. Any questions for Miss Brown? All right. Well, I want to thank you so much for joining us.
Absolutely.
And telling us what's going on around Massachusetts and, your career path.
Absolutely.
So,
thank you so much for having me. It was great chatting.
Thank you.
Bye-bye.
Take care. Bye-bye.
Bye.
Yeah, it's always nice to see Miss Brown, Brittany Brown.
It's nice to see our graduates, the alumni moving forward in the world and doing some wonderful things, in oral health, and particularly this, her job. I think that's, we all know, and we're learning, in this class that there's such a need, for, in our state, in our country, and, of course, all over the world. But, for such a wealthy country that we, the United States is, to have the amount of folks without care, with the high incidence of caries is really sad. So this is, such an important job she has.
Yes, yeah. And it's nice too working with so many different people also. That's the key, all the different stakeholders and, information that comes forward, such variety. So that's awesome. Yep. And I agree with Hannah's statement there. It's nice to hear people's perspectives and we'll have, several guest speakers and their career paths. I always love to ask hygienists, find out what their career paths were. Because it's very interesting. It's amazing the path that we go on throughout our life. So,
And then
that's great.
also, Dr. Spina posted Brittany Brown's, contact information as well. And so if you have, I don't know, a question or something that you're, have of interest in her career path, please reach out. I know she'd be thrilled to discuss anything further with you, either through email or maybe, through a call. It would be such a great mentor if you had an interest in the kind of work that she does.
Yep, so true. I agree. Yep, she would, be happy to answer any questions. So, yeah. Does anyone have any questions at all regarding next week's course, classes, regarding your project? This is sometime the time to ask because we're all together, so that everyone hears the answer or the response. Because remember, when we're in class, people hear things. You can hear people talking, chit-chatting. A virtual setting is a little different. So if anyone has a question, please bring it forth. Because we have something Ms. Holloway would like to ask everyone about her lecture, what she would like going to ask you to do.
Yes, I will be posting a survey in Blackboard either today or tomorrow. I just have to figure out how to do it and the questions to include on it. For my master's degree program, it will be great to get some feedback from you all about the lecture today. Just anything positive, negative, constructive criticism is more than welcome so that I will know how to go forward with my teaching. So that will be posted in Blackboard, and if you could all respond and give me some feedback, that would be fantastic.
Right. And whoever does respond, so hopefully all of you will respond, because you'll be provided an incentive point to go towards the chapter 5 examination. It'll be chapter 5 and 8 examination. So you'll gain an incentive point towards that exam. So, the feedback's just very helpful going forward. So, okay. Well, the time I see is 10:30. If no one has any questions, we can certainly end. You certainly can go into your collaborative group rooms if you want to continue working on that survey. For those that, haven't finished, or perhaps you want to discuss something too regarding the project, that you're more than welcome to. All right. Well, we'll see everyone then next Tuesday. Announcements will be sent out when that survey's ready, and also when the quiz is ready for number 8. I'll send out an announcement.
And the discussion board for next week. And again, the original post is due by Wednesday of next week, and a response would be due by the following Sunday.
Okay. Perfect. Thank you, everyone. Have a nice day. Enjoy this beautiful weather. Get some fresh air. It's always nice. Get some fresh air.
It is beautiful out there today here. Yeah, I know Miss Holloway has some rain there because she's getting the remnants of Sally,
It's nasty here today. It's very gross outside.
Yeah.
Oh, wow.
But we have the most beautiful day here. It's in the 60s and it's sunny. It's lovely. Sorry about that, Miss Holloway.
No, it's okay.
I know.